So President Obama is talking about health care a lot these days, and so Dr. Gary Gross is here with Brian to discuss health care reform.
That's right, because health care reform is the hot topic going on Capitol Hill right now, despite what you might want to think about cash for clunkers at this point. Dr. Gary Gross from Blood and Cancer Center of East Texas, a longtime oncologist here in East Texas, is here with us. Thanks very much, first of all, for coming in. All right, so you've seen all the rhetoric up to this point. What's your assessment of what the state of health care is in the United States right now?
Well, I think there really is a crisis in health care. This is 28 years of practice behind this statement. 48 million people uninsured in the most progressive country in the world is a travesty. And then you've got the cost of health care going up like a rocket, whereas our wages are just pretty much flatline and probably going down now.
So from a doctor's perspective, how do you fix this?
Well, I think the problem now is everybody at the table has a different incentive. In other words, the insurance company is going to make money if they take your premium, but they don't give much back to the sick patient. Hospitals want those hospital beds full, those MRI scans whirring, but that's expensive. Doctors, we get paid the more procedures we do. Well, that's an expensive way to do business. So everybody at the table, and the patient, I should say, really probably the most important, left out because years ago the patient truly stopped paying for health care, and so their voice suddenly disappeared from sight. And that's really crucial because at some point we have to take responsibility for our own health care. And I think in the future, you say, what can be done? Well, let's change the incentives.
Okay.
Let's make insurance companies have to do a couple of really important things. Let's say that you can keep your insurance when you quit your job.
Okay.
That's going to be really crucial. And you're not going to lose it for a pre-existing condition. And I'm going to give you an incentive if you don't smoke and you exercise, so you'll pay less. So that's the insurance company.
Okay.
Hospitals will get more into outpatients, so they don't have to keep their beds full. Fewer CAT scans and MRIs because the doctors aren't going to worry about getting sued.
Okay.
And the doctors, we're going to get paid for good care, what's called best practice, not for just doing procedures. And the patients, by gosh, we need to take responsibility. Now, the other side of the fence, we need to live healthier lives.
Yeah.
We cannot expect our insurance companies or the government to pay for our bad habits.
So what you suggest all sounds very reasonable. How do we get from there to actually having something that goes into effect that's going to make everybody happy, I guess?
Well, I think just to the specifics, let's talk about a couple. The most visible part of this plan that people want to throw darts at is the so-called public plan. But I think the biggest issue really in the whole system is the insurance.
Okay.
Insurance companies are not going to change their habits unless someone is stepping on their toe. And I see the public plan as an attempt to simply step on the toe of the insurance companies and provide insurance to the 48 million people who don't have it. The insurance companies say, we're worried we're going to lose all our business. But where have you been, folks? Why are these 48 million people sitting out there without insurance? That's not the business you've wanted. So I just think there needs to be pressure, and the insurance companies need to operate it with some pressure and some kind of competition.
Well, do you see a nationalized plan then being the answer to all of this?
Thank you for saying that, because it's not a nationalized plan.
Okay.
And I really think this issue of health care can be politicized, so we forget about the uninsured. We forget about the people who are one paycheck away from disaster if they get sick. I think that what the government can do is simply fill in the gaps that the insurance companies haven't been able to do. Maybe have some teeth where they can push back against the drug companies that are expecting we in the United States to pay for the research for the entire planet. So everywhere else in the world, they pay 1/5 of what we do for drugs. And I have cancer patients who are paying $8,000 and $10,000 a month for drugs. That's not sustainable.
Well, this is a good starting point. Maybe you go to Washington, D.C. today and maybe try to start talking to some of these folks, please.
Believe me, I'd love to.
I bet you would. Dr. Gary Gross, thanks very much. We appreciate you coming in and helping with the dialogue there.
Thanks for the opportunity.
All right. Coming up next, by the way, CBS19.tv is the website. You can go back there and check out the interview again. And if you have any comments or questions, you can always email them or send them to us, and we'll bring Dr. Gross back in and have him answer some of those sometime.
We're going to have a forum on healthcare on the 20th of August at the Ornelas Center. Anybody with issues, concerns, personal experience, we're going to try to have our elected representatives there.
Great.
There'll be more in the media, and hopefully you'll all be present as well.
Well, hopefully we'll get you back then, and we can talk a little bit more about that then too. Great. Thank you very much, sir. Appreciate it.